Good afternoon, good evening, and good morning. Welcome to all of you who have joined us from Pakistan and all around the world. Thank you so much for being with us today. I am Fatima Danani, and on behalf of the Aga Khan University, I am delighted to welcome all of you to our Connecting AKU webinar series. Today, we have a very special webinar planned for you, hosted by our AKU President Firoz Rasul and a panel of leading experts from our hospital in Karachi. They will share how we have responded to the global pandemic in Pakistan and answer your questions about the virus. Before I hand over to President Rasul, let me take you through the format for today's webinar. The session will run for about 60 minutes. We will begin with President Rasul and his opening remarks, and this will be followed by a panel discussion with our clinical experts, moderated by Dean Dr. Adil Haider. We will then move on to questions from the audience. To ask a question, please email connecting.webinars@aku.edu. Since we are coming to you from a number of different countries, and if during the course of the webinar we have any IT glitches, we apologize in advance. So with that, please welcome President Rasul.
Assalamu alaikum and welcome. Good evening in Pakistan and good morning and good afternoon in the other parts of the world in between, North America and Pakistan. I'm really delighted to be hosting this session for our supporters, donors, well-wishers today. It's a wonderful opportunity for us to have this engagement with so many of you. And we're looking forward to a very stimulating session. And we are especially looking forward to your questions. This has been and continues to be an extraordinary time for AKU. If you look at the sectors that have been most profoundly affected by the pandemic, healthcare and education are right at the top of the list. So the past 6 months have been a real-life stress test for us at AKU. But fortunately, we have incredible people, and you will meet some of them today. The pandemic has brought out the best in our faculty and in our staff. They have shown tremendous dedication and courage. They have shown remarkable creativity and innovation, and no one better embodies these traits than our panelists. We also have an incredible group of donors, alumni, volunteers, former faculty and staff, many of whom are in the audience today. We are extremely grateful to all of you who have supported the university. The pandemic is like a once-in-a-century storm. And thanks to your support, AKU was equipped not only to weather that storm, but to lead the response to it. In a moment of crisis, the entire AKU community has come together. As a result, we are making a major contribution to the battle against the pandemic in Pakistan and elsewhere. Our efforts can be divided into 3 major areas: clinical care, partnerships with government, and research. Our speakers will dive deeper into each area, but I will give you just a few examples. Clinical care, you will learn that we have conducted more than 60,000 COVID tests in Pakistan alone. We have admitted more than 1,000 seriously ill COVID patients to the hospital and treated hundreds more as outpatients. Our partnership with government, both with the federal government and the government of Sindh, to help improve training of healthcare workers in the country, in the province, to help in the management of intensive care COVID patients in government hospitals, and helping the government share information on this unprecedented pandemic has been a big part of our contribution to the country. And in terms of research, we are part of a global effort to develop new tests, treatments, and to test vaccines ultimately for COVID-19, and you will hear more about that. So in short, we are doing a lot to address the pandemic, but that is not all we are doing. We're also educating our future leaders. We have gone online for over 90% of our students, with the exception of those students who live in remote areas where internet access is not available. But we're also working to solve the problem for them. We are also, as you know, continuing our core operations. We continue to serve non-COVID patients because they are the ones who need our care. They used to come to us. Some of them are fearful of not coming anymore because they think we're only treating COVID patients. That's not true. We are right at the forefront of helping the country with COVID patients, but equally, we want to make sure that people continue their care and treatment at AKU because delaying it would be very dangerous for them. I'm very proud of AKU's performance over the last 6 months. Our founder and chancellor, His Highness the Aga Khan, believed that a university devoted to achieving excellence and creating knowledge could play an indispensable role in tackling the biggest challenges facing Pakistan. Today, we are seeing evidence of that. Undoubtedly, the pandemic is far from over. We have a long way to go, but we will face all these challenges together. And I'm confident that AKU will continue to play a leading role in the fight against not only COVID-19 and its effects, but other pandemics or diseases that affect Pakistan. So to learn more, I'm going to turn it over to our moderator, Dr. Adil Haider, the Dean of the Medical College, to now moderate the session. Dr. Haider.
Assalamu alaikum and good morning, good afternoon, and good evening for participants from around the world. Before I begin, I want to thank our colleagues in resource development for putting together today's webinar, and particularly thank President Rasul for those very heartwarming remarks. You know, we had incredible support from all our leaders at AKU, and the president has really led from the front, encouraging us and making sure that we have everything we need to be able to do the response that you just heard about. But I also want to thank each one of you. I see that there are more than 250 participants who have logged on, and that number keeps going up. And I will tell you that the kind of support we at Khan University, at the university, and at the hospital have received from all of our supporters is just incredible. Be that just a simple phone call from friends and colleagues of the university who've texted and say, hey, how are you guys doing? How can we help? To being just understanding patients when I've had situations where friends of ours have called in the middle of the night trying to take care of a medical problem, and being very understanding of what we could do for them. And sometimes, you know, if the emergency room was busy, we was like, okay, well, if you just come in a couple of hours, we can accommodate. And people have been so generous and so responsive to everything we've asked for as physicians and scientists. And so I just wanted to start with thanking all of you who've logged on and who, of course, are showing your commitment by spending the next hour with us. Now, many of you have sent in very interesting questions in advance. And so for that, we have assembled a really remarkable group of individuals who are leading the fight against COVID, and I will say against disease in Pakistan. These are individuals who have the highest training possible, could have been anywhere in the world, but they chose to make AKU and AKUH their professional home and serve the people of Pakistan in a way that makes us all proud. So I'll ask each one of our panelists to introduce themselves and their specialty, and then we'll begin with the questions. And then, of course, I'll give more instructions that you just heard from Fatma. You can send questions now as well, and we're going to spend the whole thing basically on your questions. So we'll start with Dr. Unab. Introduce yourself.
Hello, Assalamu alaikum everyone. My name is Unab Khan. I'm the chair of the Department of Family Medicine and an AKU alumni class of 1993.
Dr. Faisal.
Hello, everybody. I'm Faisal Mahmood. I'm the chair of infectious diseases and also infection control, and I'm alumni of class of 1997.
Dr. Asim?
Assalamu alaikum. Good day to everyone. I'm Asim Beglaumi. I am a pediatric oncologist, but I'm actually the Chief Medical Officer for the Al Khan University Hospital in Karachi. And I'm also an alumnus, class of '89.
And Professor Zahra Hasan?
Hello, I'm Zahra Hasan. I'm professor and consultant at the Department of Pathology and Laboratory Medicine, and my interest is in diagnostics of infectious diseases.
Thank you so much, and thank you for introducing yourselves. Yes, I forgot to mention that it just happens that 4 of the 5 panelists happen to have received their medical degrees right here at AKU at different years, including myself, and we're all, of course, we love to say that. So we'll start with the first question to our CMO, and this is Dr. Asim. People are worried about coming to the hospital. There are 5 questions about this, and I'll just paraphrase. They're like, is it safe to come to the hospital if I don't have COVID? What kind of facilities are devoted to COVID? You know, do I always have to wear a mask? Can I bring an attendant? So could you give us a little overview of the things you've made sure we have for safety of patients, COVID, non-COVID?
So thank you, Adil, for that. You know, right in the beginning, in actually January and February, when this whole thing started off, we started thinking about what we need to do in order to prepare for the COVID pandemic coming in, but also ensure that our staff and the rest of the patients remain safe. And that discussion actually has continued and continues even today. And a couple of things that I'm going to point out that we did over this period of time. The first thing that we did was that we decided that we must have a facility to care for our COVID patients. That the facility that we have must be separate from that taking care of other patients, and must have all the requirements for taking care of patients with infections or with virulent infections that can cause, that can pass very rapidly from one place to the other. So in that context, what we went ahead and did was we went through a lot of different options, but then landed on our old private wing. And the reason we chose that was it was a standalone building with its own infrastructure, its own air handling. We were able to segregate that from other areas of the hospital. We were able to, for a lot of the rooms within there, we were able to change them to negative pressure rooms so that that would increase the safety for our staff and for other patients. And then what we did also was we converted those rooms into different levels of care for different kinds of patients. They were general isolation rooms, but there were also high dependency units that we created within there that could take care of patients with greater need, as well as those who needed ICU. So we created our own ICUs within there. There were rooms for children as well as for adults, and we were able to carve out 112 rooms dedicated for COVID care. We also developed strategies to ensure that the people coming in and being admitted to these areas were well taken care of, both in terms of the expertise of the people taking care of them, but also in terms of the kinds of spaces that they were being cared for in. And that really has been successful. We've been able to take care of, as President Rasul said, that we've cared for over 1,000. I think the last count I had was 1,065 last week. So it's above that now already. And I can tell you that over 800, 900 of these have gone home. So that has been quite encouraging and remarkable for us as well. What we've also gone ahead and done is created spaces within other areas of the hospital or created processes in other areas of the hospital that would allow us to identify patients who might be at risk for having COVID. And if any of you visited our outpatient clinics, for example, you know that we've got screening desks outside where we question patients and their families who are coming in about where they've been, what symptoms they have, why they're coming into the hospital, what the, and all of that. And that really has allowed us to screen patients and decide whether they can go in with the rest of the patients, what their risk of infectivity is. And then those that we think are potentially may have COVID, and our threshold for that was really, really low. So we were really screening, we are continuing to screen patients at a very low level. And those patients can then be taken to other areas and be tested.
So to summarize,
yeah, go ahead, Adil.
no, I was just going to say, to summarize, there is a very defined place where there are patients who have COVID or even suspected COVID, that they're
Correct.
sort of put in a bubble, and that this is actually a very small proportion of the general hospital. So it's what, 1/8 of the size of the hospital. And the other
Yes.
80% of the hospital, tell us a little bit, is that fully functional? Can you come get what you need? Should you not? I mean, tell us a little bit about how those areas are all separated and protected.
Yeah. So, I mean, the idea, as I said earlier, was to create this segregation. And the reason to create this segregation was so that we can care for all the other patients, right? We can't concentrate on one disease at the expense of all other ailments. And so we've continued throughout to provide care for all patients who need them. Transiently, we stopped certain elective admissions and elective surgeries just because we weren't sure how things would move. But we've opened all of those because we could open them safely.
So we're all
we have
ready.
Yes.
So we're all ready for all sorts of other patients and so on. So in that, let me move to Dr. Unab. So Dr. Unab is our chair of family medicine, and she's also my family's doctor. So thank you so much, Dr. Unab. Many people are asking, and I have 2 or 3 questions. Can you come for your regular care? Should you be getting your regular care? Should you be getting your immunizations? Should be getting, you have asthma. One person has asthma here. They're like, should we come to be seen because I have this airway disease? What should patients do to come to the regular doctor visits?
Thank you, Adil. And I think this is really important that we all take care of ourselves completely. Just worrying about COVID will not take away all the other problems that people have. We know that people who have long-term conditions like asthma, like COPD, like diabetes, like heart disease have to come in and see their doctors. We have created opportunities to do it safely within the hospital. But along with it, we've also created teleconsultations and teleclinics so that there are people who may not need to come in for those follow-ups. You can still continue to connect with your doctor and have continuity of care. So please come in and get your care. You can do it in person if that is required and the doctor tells you, or you can just connect with your doctor via teleconsult and you can get the same quality of care so that your health does not get affected.
In the same way, are there some special protocols that you would recommend to anybody who's coming to the hospital for their regular care? Is there something different they would do this time?
Right. So, as you are coming to the hospital, as you are getting out of your house, I think we are all changed the way we think of normal. We all try and be better protected. So wear a mask, wear some kind of a covering on your face and your nose so that when you go out into the real world and you're exposed to the next person, God forbid, if they're infected, that you really don't get infected by them. The second thing is trying to keep a little bit of social distance, the physical distancing that we talk about. So, just a 2-meter distance or a 6-foot distance with whenever possible. And so the mask really protects you if you are coming in closer contact with others. Carry a hand sanitizer with you. We try very, very much at the hospital to ensure that we are continuously disinfecting areas which are being used by patients, and we're all high touch areas, but just having a little bit of a disinfectant with you and hand washing. 3 basic simple things that all of us can do to really protect ourselves and our families. And people will notice that when they come in, we allow just 1 attendant at a time. And that really is because you want to cut down on the number of people in any closed space and allow people to have the opportunity to do the physical distancing that we're talking about.
Thank you, Dr. Unab. Let me move to the next question, which is a little bit about masks. And it's going to go to Dr. Faisal Mahmood. First, can you tell us how well do masks actually work? What kind of mask are we supposed to wear? But then the big question is, are these numbers that we're seeing that maybe the numbers of infections are going down? Is that really true? And what is actually happening with the pandemic in Pakistan?
Thank you, Adil. So masks, that's a simple one. I think masks we know help. They're not, they don't obviate the need to do social or physical distancing, but definitely they're one additional layer in protecting. And remember, masks have to be worn by everybody, regardless if you think you have the infection or you don't have the infection. And the type of mask for people who are out there in the community, a simple cloth mask is fine. You just need to wear the proper surgical mask when you're in the hospital. And those fancy N95 masks, which are really expensive and fancy looking, those are really only for healthcare workers in the hospital in certain circumstances. So by and large, a simple, more comfortable surgical mask is fine. To answer your next question, what is happening to the rates in Pakistan? So the simple answer is they are going down. Testing has gone down a little bit, but it's pretty much steady for the last couple of weeks. And the number of patients we're seeing, even in the clinics at AKU, patients in the ER, I mean, overall, the numbers have gone down for sure. So it's not a conspiracy by the government to hide numbers. It's real. I guess the tougher question, which I hope you're not going to ask, but I'm just going to answer, is why is it going down? And that really is the million-dollar question. We don't know. We think it's probably a little bit of everything, a little bit of really early graded lockdown that had happened over here, and then easing it open, also not really opening up completely. In the country, we have actually a pretty good contact tracing mechanism in place, and a number of cities actually have smart lockdowns in place, which has really, and you can see these in depending on which city you're looking at, how the numbers have dropped depending on what sort of prevention they've done. So really, I mean, this is a conversation, one of those dinner table conversations that as ID folks have, that what did we do that's correct, but clearly the numbers are going down. I think the one thing I do want to tell everybody, at least in Pakistan, is that please don't celebrate just yet. Eid is around the corner. We're not out of the woods. Just keep doing the precautions that you have to do. Thank you.
So Dr. Faisal, just so everybody knows, Dr. Faisal is actually one of the lead national advisors to federal government and Sindh government on what to do. So if somebody's talking about numbers, you clearly know about them. We saw a big spike in Pakistan after Eid al-Fitr. Are you worried about such a spike? And how can we, there are more than 300 people listening, how can we all make sure that we don't have another spike after Eid?
So clearly, and this is very clear from the numbers that we saw, is that about 2 weeks after Eid, our death rates just skyrocketed, and this is clearly a super spreader event that happened in Eid, and we really have to be careful you don't do the same over here. And there are a number of things you can do. The number one thing you can do yourself is not to have an Eid party, and don't go to an Eid party, and that's probably the easiest and the best thing you do. Adil, it's really bad, but I saw a number of families in which there were a number of deaths that had occurred right after the Eid, the parties that they had. So these are not safe activities. Buying meat or buying not meat, but the cows and sheep and then goats, etc. So there are very good SOPs that we've now put in place from the government side. Follow them, and very briefly, just make sure one person goes, buy online if you can. Make sure you don't make a family affair where everybody goes together. And then finally, the simple 3 things Unab already spoke about: keeping your hands clean, wearing a mask at all times, and staying at least 6 feet away from people. And I think we should have an easy Eid after that. And make sure you tell this to everybody because that's how that's how information spreads. Thank you.
Thank you much, Dr. Faisal. Similarly, Dr. Zahra Hasan also is on the national task force to figure out how to do the test correctly in Pakistan, and in fact did the first test outside the public sector in Pakistan and developed it here at AKU. Dr. Hasan, could you please tell us a little bit about testing, and specifically the question was, which one are you supposed to get, the PCR or this blood test?
Thank you for asking about the tests. It does seem confusing, but there is only one test that you can use to look for the virus itself. And because the infection is a respiratory infection, you know, it is the respiratory sample which is collected through your nose, which is the only sample that will tell you whether there's a virus in it. And then a PCR is done with that sample. The second test that you've probably heard about is a blood test, which looks at how the human body has responded to the virus, and that will tell you about exposure to the virus. So if someone needs to be worked up or needs to be checked for infection, it's the PCR test that will tell you about infection, while the blood test will tell you about exposure, prior exposure. So they're actually two separate things.
Professor Hasan, I was going to say, could you also just tell us about testing in Pakistan? We hear that the number of tests have gone down. Is that a good or a bad thing?
It's a very good thing. So when we started in February, we were one of probably the first lab to set it up mid-February. And by March, we were doing hundreds of tests a day. And at the peak in May and June, we were doing about 1,000 tests a day or more. And now, as has been, you know, mentioned by other people, and you know from the news, the number of cases has decreased, and the number of people presenting with symptoms has decreased also. And we are doing a few hundred, so we've probably halved the number of tests. But as a tertiary care facility, we will always continue to get samples from people who are seeking care, and as we get samples from all over the country, not just Karachi, we have an outreach laboratory all over the country that will receive samples, and we receive samples for the government. So we are testing not just for our own hospital in Karachi, we are receiving samples for the government and for the provincial and the federal government also. So, but the numbers have reduced, and we hope that it will stay that way.
And finally, next question on testing is about people have made some comments about tests done on the outside, at other places. So we won't get into that, but can you tell us how are we so sure that the tests you helped develop here at AKU works?
So what we're using now is something that is of the highest standard. It is a CE or you know, the best diagnostic test that has a very, very sensitive viral limit. It can test, you know, detect even 5 viruses. And we're using a platform which has full automation and has minimal involvement of possibility of human error. So we are very confident about the tests that we are doing. But there's always variation, because the first step is, as I said, sampling. So the test is only good as the sample that's collected. There may be variations in the way that people have collected the sample from the nasal passage or the nostril, and that can cause variation. So, and also there's day-to-day variation. So one cannot compare labs directly, lab results directly, because the way the infection is in the individual, the number of viruses also varies. So if you sampled one person on day 1 and sent it to one lab, and on day 3 sent it to another lab, those 2 samples are not comparable in any case.
And of course, the lab is accredited by the CAP accreditation, which is a Council of American Pathologists, and are we really the only lab in Pakistan that has that kind of accreditation and standard?
That is correct. We have College of American Pathologists accreditation. We are the only laboratory that has that, in addition to the JCI accreditation that the hospital has. And that accreditation is not just for the COVID tests, it's for all laboratory tests. So it's a pan-laboratory accreditation.
Okay, great. The next question actually is about public-private partnerships, and maybe I'll take the liberty to answer this. This is about, you know, how we're partnering with the government, and I'll give you a little background. The President Firoz mentioned that we have a partnership with the government to do tele-ICU care, and what this really is, it really stems from the values of AKU, which I know many of you heard about, and we like to call IQRA. I for impact, Q for quality, R for relevance, and A for access. So IQRA. And the idea is that we wanted to, create some program that we could work with the government where we can have tremendous impact throughout the country, where we would be helping improve the quality of care that would be relevant to what is needed and improve access to folks. And in that light, we saw that, and many of you must have heard in the news that, for example, China and others were donating all these ventilators and all this critical care equipment to help patients who were severely ill due to COVID or other issues. The question, though, is there are not enough trained people to take care of those patients. So you might have all these new machines flown in, but who's going to run those machines? And now we're very lucky and fortunate that at AKU, we have some of the best experts in the world. And when this was going on, the president said, look for a project where you can have tremendous impact. And at that moment, the Minister of Health, or the Federal Minister of Health, or the Special Advisor, phoned and said, look, we have this big issue about critical care training. Could you help us? And that afternoon, we sent him a proposal. And by that evening, he didn't send like an official proposal approval. He actually tweeted out a response. He put on Twitter, thank you to AKU, you're gonna help us train 5,000 people in doing critical care. Now, that was a little surprise to us as well, that, okay, we're gonna do this. But anyway, we ended up with a project where we're doing these teleconsults. We have a control center here where our ICU physicians, through video conference, work with ICU physicians at these new ICUs all across Pakistan, specifically Sindh province, where there are 13 or 14 places where our physicians actually do video rounds with the physicians over there helping them. So that really helps improve quality, helps improve access. We've also trained, as you heard the president say, thousands upon thousands, and many of the people on the panel here have been the course directors for either the We Care program, where we're training healthcare professionals in how to use their personal protective equipment properly, or we're talking about the most advanced treatments for the disease at hand. In fact, if you want, you can go to our Facebook page and even see Dr. Faisal Mahmood's lecture on the best treatments for COVID. And you'll notice that you're one of the thousands and thousands of people who've looked at that video because it's probably the most famous video. And now he's obviously called the Corona Wala Doctor because of that and many other things, of course. And then finally, we're also doing an evaluation of the current ICU infrastructure in Pakistan and giving feedback on that. So that's just, and I got to tell you, there are tons of different research projects and I'm happy to get into them. But that's just one example of how we're partnering with the government. So that was in response to the question about partnership with government and so on. I'll move to the next question, which again is about the facilities. Again, so Asim is coming up again and again. And the question is about the emergency department. And that the facilities are common and people in the emergency department might have COVID and you wouldn't know, and they're using the same bathrooms. The area is the same. How are you protecting patients in the emergency department who may or may not have COVID?
So Adil, the first thing is identifying those who are potentially infective right up front. And what we did for that is actually created a triage outside of the ED, the emergency department. What that does is that all patients are screened right up front, and again, keeping a very, very low threshold for symptomatology. We can segregate patients into those who might have COVID and those who are not infective, even if they have the COVID, and Faisal will vouch for that, is that the infectivity really is when one coughs and sneezes and spreads the droplets. The other thing that we did as we move into the emergency room is we've created a whole negative pressure space for those patients who we think might have COVID and might be infective in spreading the COVID. So those patients are immediately put into those areas and do not mix in with the other patients. Even those other patients that are there, we've actually reduced the number of beds that we normally have in the ED so as to increase the space between beds. And we've actually maintained that 2-meter space that we have between there in order to ensure that even those patients who we think are not likely to be infective are also kept separated from each other. So those are all the measures that we've done. We've continued to ensure that our staff is in full PPE so that they don't contract it and pass it on to others. We've also been very, very careful in terms of ensuring that those patients who we think might have it are really, really separated out at front. We've also tried to speed up the transit time from the ED so patients don't spend as much time. We've not been totally successful in that, especially during the very, very high COVID peak in the middle of June, for example, where we had a lot of patients with COVID, and that's why we had to go on diversion. But now what we're really doing as that load is decreasing is for patients who are coming in with other diseases, we've put in mechanisms where they can very rapidly be diagnosed and admitted to the hospital if they need to be admitted, or sent home with appropriate treatment if they need that. I think we've lost Dr. Adil for a bit. These are the technical glitches that we spoke about right up front. There he is.
Very nice. You know, I'm supposedly sitting in the best place with internet in the hospital. So there we go. All right. So the next question is to Dr. Unab Khan. And that has to do, again, with safety. This is more about how do you stay safe at home, and how do you protect yourself from the virus just in general?
Okay. So I think it's really important for all of us to, as I said before, there are new normals, right? I don't host parties at my house anymore. We do Zoom parties. So in the same way, it's good to kind of think and be careful of who's entering your house. And even as a family, making some ground rules of when you go out, what are you going to do? How are you going to keep yourself safe? So that when you come back in, you're really not exposing the rest of your family and loved ones to a potential of an exposure or potential of an infection. At home, for people like us who work in the hospital setting, if you have vulnerable people at home, so for example, if you have elderly parents or somebody who has immunocompromised, so for example, has an illness which can really put them at a risk of getting more severe disease, we try and cocoon them. So those are the people who I don't go very close to. We have our conversations a little far away. We may have lunch or dinner together, but sitting a little further away from each other. So even at home, two things again are: number one, ensuring that when you go out, you have ground rules that everybody follows. So wear a mask when you go out and everything. And as soon as you enter the house, again, throw that mask out, wash your hands. If you've been around somebody and you couldn't keep your physical distancing, then go ahead, take a shower, change your clothes, and then come back and sit with family. Right? And again, try and keep going out to a minimum. So do the necessary things. You don't have to, we're not in complete lockdown anymore, but, just be mindful of what we do to keep ourselves safe at home.
And I got to say, Dr. Unab, I think it is one of those times where it's okay to be, straightforward. If you're at a store and there's room and somebody's really coming up to you, either move back or, move back yourself. It's okay to self-police. I had a friend who said, I'm going to drop by your house. And I said, let's just talk on the phone. And they insisted, and they came, and I said hello to them in the driveway. And they themselves said, I know you're not going to invite me in. And I said, I know you came all the way from America, but we're not going to go down like this. So I think it's important for us to, maintain those very politely.
Yeah. And I think we as such can all be role models to others, right? So if others are trying to learn what these new norms are, we don't shake hands anymore with our patients. That was something that is very common to us, which comes very naturally, but we stopped doing that because, I don't want to put you at risk, and I don't want to put myself at risk. So I think it's important that there's that mutual feeling that we're trying to prevent passing the infection to each other. So it's not just me trying to save myself, but I'm trying to save you also at the same time. So wearing a mask when I'm around people, washing my hands, making sure that I'm not in spaces where I don't need to be. I think I'm being respectful to the next person and trying to keep them safe too.
So the next question goes to Dr. Faisal. This is a very technical question, and must have been an engineer. They're saying that the air conditioning is attached for the hospital's different places. And so wouldn't the air conditioning spread the virus?
So Adil, that is a technical question, and I must say that since COVID came, I've had to have a crash course in air conditioning and in HVAC, and so the answer is no, and I'll tell you why. As Asim had mentioned earlier, the building where we house the COVID patients is a completely standalone building, and all the air that goes into this building is actually 100% fresh air. So none of that air gets recycled, which is actually one of the first things that we had actually looked into to make sure that we're not recycling the virus and making it more and more concentrated. So it's actually a fairly safe place. And patients where they're housed, all that air actually just gets moved out of the building immediately and far away so that nobody else is infected around it. So the short answer to the question is that we've thought about it, we've looked at it, and in places where we have COVID patients, we have 100% fresh air coming. There's no recycling of air, and that's what makes it so safe.
And there's a similar question here, and that is about in the operating rooms. Usually, the operating rooms will require negative pressure rather than the standard positive pressure air conditioning that operating rooms have. Has that been taken care of, Asim?
Absolutely, and I think that was one of the first things that we did, is we identified we have a separate OR that we actually used for high-risk surgeries. And what we did was we converted that whole area into a negative pressure space. And so all our COVID positive or COVID suspect or COVID unknown patients are actually undergo surgeries if they need it in those ORs. And these are separate from all the other ORs in the hospital.
And as a surgeon, I got to say, I'm grateful to those. You know, our engineering folks really are wonderful. And they are, you know, one of the guys actually has a PhD in HVAC, or, you know, what does HVAC even stand for?
It stands for
ventilation and cooling. Something like that.
Yep, heat, ventilation, and cooling.
All right, I'm just making up as we go. All right, so the next question is about research. The professors are, and this is about, have we done some research on vaccine? When will AKU be getting a vaccine if it's getting it from outside?
So AKU has always been involved in research on pathogens and how they cause disease. And when the pandemic started, it was an opportunity for all the infectious diseases researchers to get started and start trying to understand the virus and try to understand the host and the infection that it causes. So we are studying the virus to look at the variations, because we understand that now that the different clades or variations across the world. We're studying host responses, and that is in the context of also understanding how you would examine how a vaccine works. So we're not directly testing any vaccines here. In fact, everybody knows that there are a lot of vaccine trials ongoing in the world, and it's still, you know, in the early stages. We don't know what kind of vaccine will work best. But what we need to have ready here is that when a vaccine comes, we need to be able to understand whether the vaccine has had an effect. And we are working on those assays. And we have been very engaged with our international collaborators. We've worked with people in the US and in Europe who we worked with before through international partnerships. We have built new partnerships. And these have, so it's been very, very sort of an engaged period where in addition to all the work we've done for diagnostics, we have been embarking on different aspects of research that will hopefully help us understand whether vaccine works or not in our population when it's here.
Thank you, Professor. So it's about 7:45, and we are getting a bunch of questions. So now let's call it our rapid response round, where we're going to try to give shorter answers because there are at least 10 questions lined up. And again, if you want to send more questions, please do. And remember, it's connecting.webinars@aku.edu. Connect.webinars@aku.edu. All right. So first question, Professor Zahra. This person lives in Lahore, so why can't you do a COVID test in Lahore for him?
So we are accepting samples from Lahore, samples that are submitted through the provincial government or through a physician in Lahore are accepted at the Lahore collection point. So from the start, we have been accepting samples in Lahore. What we have not had the facility to do is because the Lahore collection point or the Lahore test center is a small space, we haven't had the ability to sample on site. But we will soon be introducing another process of a simple nasal nostril sampling, which can be done in Lahore as well. So that will be coming very soon.
Next question, thank you. Next question is to Dr. Unab. Are there any patients specifically who should not come to the hospital?
So anybody who is at this point in time not very sick, but has a significant heart disease, really should not be, or you're very, very elderly. So, anybody older than the age of 70 or 75 should not come into the hospital necessarily. However, if you're feeling unwell, do come in and get care. And for all of those other people, if they have chronic illnesses, please do follow up with us in our teleconsultations, because you can certainly do that. And that's a very safe way of having your continuity of care. Again, if you do choose to come in or you need to come in, know that the place is very safe. We are working really, really hard to ensure that we're keeping the place safe for our patients and even for ourselves.
Yeah, thank you. And that for yourselves thing is important because, we, in fact, Dr. Unab has led the whole work towards making sure our healthcare providers are protected. Healthcare providers are, we at AKU take great pride in our healthcare providers, but they're just not enough in Pakistan. So we have to protect them in AKU and of course outside. So that's why we spend a lot of effort to protect them. Unless we protect them, we can't protect everybody else. So that's just an example of what needs to happen. The next is about the costs. And this will go to Dr. Beglaumi. Is there a difference in the kind of care provided to people based on cost? And what happens to people who can't afford it?
All right. So the first thing is that we've learned that the care for patients with COVID is expensive. And there's multiple reasons for that. One is they have very, very severe symptoms. They have very, very bad pulmonary or lung conditions, breathing problems that require ventilations, mechanical ventilations. But also what is very important, what we learned is that a lot of money is needed to be spent on protecting the care provider as well as other patients who they're taking care of. And the use of PPE becomes an expense that is there. However, we've not refused anybody care when they come to our emergency rooms with COVID. We've admitted them, we've taken care of them, we have provided them with welfare, we have included them within our zakat. And I can tell you, just today, we were reviewing some of those patients, and there were patients whose charges were over ₹1 million or 2 million rupees. And we were saying, well, we spent it, and now this patient is going to go home. And so that's never been an issue. Patients who've come to us, we've taken care of them regardless of the cost.
So Dr. Beglaumi, we, AKU, and many of the people on today have contributed to this. So thanks to many of the people, especially the Patient Behbood Society and folks who give into patient welfare. We did what last year, on average, about $30 million US for patient welfare. And currently, of course, if you're admitted with COVID or any disease for that matter, based on your eligibility, you can get patient welfare. And from what I know, and Professor Zahra, you can remind us, if you need, somebody's asking specifically, question number 5 here is about testing, and if you can't afford it, there is specific zakat allocation for people who want testing. Maybe one of you, Dr. Unab or Dr. Zahra, you could expand on that.
There is, I think, sorry. So there is a COVID testing process where if you come to the COVID testing site and you can't pay for it, I believe you can ask for zakat for that. And it's a simple process. So you will get subsidized or free testing like you do for other laboratory tests, because the Department of Pathology often waives off charges for patients who can't afford the full price. So this is also the case for COVID testing.
Dr. Unab, were you going to expand on our patient welfare support?
Yes, just to ensure that these are not just for zakat, but even for people who require patient welfare. So you may need the subsidized cost. You may not be able to pay all of it, but also for people who are zakat eligible, as Dr. Zahra said, they can get it almost free of cost. So it really is a tiered way of doing things. But we always make sure that if somebody needs something, we can make sure, we try our best to ensure that they get it. Especially, and this has been specifically done on the main campus at the COVID testing site to ensure that we don't turn anybody away when they come in for the test.
You know, I'll say that as dean, I get to speak to a lot of physicians, and remember, all of our physicians are also academics, right? So they're professors, so Professor Beglaumi, Professor Hasan, and so on. And many of the academic-minded physicians went into this business because they wanted to take care of patients with fewer means. And this ability to take care of patients with a large amount of philanthropy, which is a huge number, $30 million in Pakistan is a giant number, is one of the biggest attractions that I know our physicians have for their own satisfaction, that they're able to, you know, I was just talking to somebody in oncology, and he was telling me how they had a patient and that there's a special oncology patient welfare fund. And through that, they were able to get this person a very large operation, which they needed to get for their sarcoma. So those are the kinds of things which are super important. Dr. Unab, the next question is a very important one. This person wants to go on a flight. Is that okay to go on an airplane?
Actually, airplanes are quite safe. You know, the air exchange, the kind of HEPA filtration that they have, the air filtration makes the airplane itself very safe. I think the times when you need to be cautious and cognizant of your space around is at the airport. And so before you get on the plane and after you get off the plane. So those are the times when all the 3 things that we were talking about, the physical distancing, the hand washing and hygiene, wearing a mask, you know, using a surgical mask even on the plane is really important, because you don't know what the person next to you may have. And if you're in that close proximity, you don't want to kind of do that. But otherwise, absolutely, the plane ride itself is pretty safe.
Speaking of safety, we have a very senior supporter of AKU who has been the chairman of the Patients Behbood Society and previously, and they comment that you know, AKUH should be the safest place to be, or something. It's a long comment that I'm reading. Do we think AKUH is one of the safest places to be in Karachi at the moment, as far as it goes? Faisal?
Yes, it is, I think. Clearly, it is one of the safest places to be. And, you know, to be very honest, I mean, these systems we put in place even before COVID came. And that's why it's been so easy for us to build up on this. A lot of this work we've been doing, a lot of the screening in the clinics was actually before COVID. And that's how, in fact, how we caught our first COVID patient also, just through our routine work that we were doing. So, and all that safety has just been enhanced, if anything else.
I will give you a little pushback. I mean, I know you're the also the director of DIFI, or Division of Infection Prevention and Hospital Epidemiology, because I have received a few complaints that how many times you're cleaning it, it wasn't as clean as I thought it would be, and so on. Are we instituting more because of COVID? I know we already had these symptoms, but what are we doing more to make this even more safe?
So I think we're doing a lot more. And actually, if you look at all of the national and international guidelines, we're actually going above and beyond what is currently recommended. As an example, any patient going in any of the wards, and for our healthcare workers, we institute complete sort of precautions for everybody. All surfaces are cleaned even more than we used to. And now I'm not talking about the COVID units, I'm talking about units where we don't have COVID patients. Because we don't know who may or may not have the infection, we take precautions at all times. And this includes, as Dr. Asim said, the visitor policy. So everything is really geared towards preventing infections between patients, between our healthcare workers. And this actually, to be very honest, goes beyond COVID also. This prevents other bugs from anybody coming in to get other bugs also. So we tend to forget there are lots of other infections in the world beyond COVID. And all of these measures actually help us prevent all of these as well.
The next question is about, is AKU working with countries outside Pakistan and helping to develop their health sector? So maybe I'll take that question. As many of you know, we have a partnership with the French Medical Institute for Mother and Children in Kabul, Afghanistan. And of course, we partner with them. In fact, their ICU, we are working with them. And this morning I was standing there as they were doing ICU rounds together. So definitely we're helping. But remember, AKU is a global university. And we have a big, great hospital in Nairobi, which is really state-of-the-art, advanced, and is doing a tremendous job. They had a field hospital set up before everybody else. They have taken care of the most complex and complicated patients. And there's a lot of cross-learning between the campus in Karachi and the campus in Nairobi. We also have great partnerships with the Aga Khan Health Services and 4 other hospitals right here in Karachi. So AKU is a global university with a lot of healthcare presence throughout the world, and we are all participating with one another as far as that. Next question is specifically about masks to Faisal. How long can you use the particular mask? A surgical mask, a KN95 mask, and a N95 mask. How long should you use each one?
All right. So how long can you use any of these masks? So generally we say if your mask gets wet, you should replace them. So a surgical mask, you could use, ideally in the ideal situation when you have, enough masks and everybody wasn't using them, we would actually say you should change your mask every 4 hours or so. But in the real world, now that, we know that masks are not so easy to come by, we usually say you can wear it unless, it's visibly dirty or it's wet. The N95 mask is similar, and this one we do reuse, and actually around the world now we're reusing these masks. And I tell patients, and I'm going to slip into a little bit of Urdu, but so until it's a twisted and turn and physically deformed, you can use this mask. And again, a lot of these things we do because we know that these are important, but we also know that these are a finite resource. So generally, until you can use it.
I am getting word from Ms. Dhanani that could we go over 5 minutes because they still have a few questions. Is that all right, everybody? All right. Well, I'm kind of putting you on the spot, asking you right there while we're live. All right. This is to you, Professor Zahra, which is, at which day can I go for an antibody test? Like, and maybe you can also talk about what the antibody means. Does that mean immunity passport?
Okay, so the antibody is the response that the body makes once it's seen the virus. And at the earliest, antibodies come up 1 week after the beginning of infection. Since we don't know when somebody may be exposed, you don't know exactly when day 1 is or day 0 is. So it's really hard to count days. So if you were symptomatic and you had infection that was diagnosed, you were virus positive, you could count the day 7 from that. But if you don't know what your day 0 is, then it's a little bit hard. the question is, why would you want to get the antibody test done? Because the antibody test will tell you if you've had exposure to the virus. But it would be, at least a week or 2 weeks later. So it would be, useful if you wanted to know if you were exposed, which is something that people do for public health reasons. It has value for what we call seroprevalence, to understand how many people were exposed. The other point to keep in mind is that studies have shown that the antibodies don't stay for very long. So if you get your antibody test 2 months after you had symptoms, so if you had symptoms in February and you get it done in May and it's negative, it won't mean anything to you. And the last point about protective immunity, most of the antibody tests that are available right now have no association with protection. They just tell you about exposure to the virus, because there are many different kinds of antibodies. And the kind of antibody that will kill or neutralize the virus is a very specific one that is found in a small proportion of the whole set. So you need a very specialized test for that. So don't use any of the regular commercial, cheap and cheerful, easy blood tests to try and assess whether you have protection against the virus.
Thank you so much, Professor Hasan. Dr. Unab, this question is probably maybe from one of your patients, and they're like, can I come for my eye operation to AKU, or should I come?
Yes, please. If you have an illness like glaucoma or cataract which needs to be operated upon, you can safely come in and get your surgery done. Initially, we were saying we should stop all elective procedures, and that was the guidance from the WHO, from the CDC, and that was at the time when the virus was increasing, and we did not have enough protective measures in hospital settings. Now that the hospital settings have been made in such a way that we can safely do these things, I think come to a safe place like AKU. I feel that if I had to bring a family member, this is where I would come, honestly speaking, just because I know how much effort and energy has gone to ensure that anybody who comes in for an elective or an emergent issue is going to be taken care of safely. So please go ahead and come and continue with your care.
May I just add something to that, which is linked to the question earlier about surgeries and what Dr. Unab said, that we are actually testing all patients for surgery. So there's a pre-operative screening that is being done to make sure that the people who are going into surgeries, either routine surgeries or people going into the labor ward, and certainly dental surgery. So any possibly aerosol generating procedure is being pre-checked to reduce exposure so that they can be managed appropriately.
Thank you all so much. We are at 8:03 and we're still about 300 people logged on. I'm going to stop taking the questions, but I will answer this large question that I apologize completely missed early on, and that's about what's happening with our medical students and other students. And the question is, how have they been infected or affected, and what are the plans for the academic year? So thank you for asking this. Yes, our students have been affected just like students around the whole world. As soon as the pandemic hit, we immediately constituted, by the way, we have this whole COVID command that looks at all these aspects, and all the things that we're doing are based on projections that we are helping build for Pakistan and so on. So we're quite in the thick of things. And as soon as the pandemic hit and the government said send all the students home, we immediately complied and sent our students home. To bring our students back, we require three things. First is that it has to be safe for them. And since we're talking about, I'm primarily talking about students who are in the hospital, so medical students and nursing students. Of course, we have a whole bunch of other graduate students and PhDs as well. But for the clinically oriented students, we only want to bring them back when it's safe for them to be here and safe for patients to be here, first. Second thing is, we need to have the clinical substrate. We need to have patients who are comfortable with students around them. So that has to happen. And then, of course, we have to have the governmental mandates that you have all heard about. Our students, I got to tell you, I am so proud of them. They are doing just fantastic. Within 4 days of us sending the kids home, our first and second year medical student class was completely online. And then a few weeks after that, almost the entire university went online. It is just incredible how fast AKU systems were able to just respond and get everybody online. And we have now even figured out ways to do very secure testing of our students, and so that they're not losing time. Now, of course, for those who have to come and get clinical training, so our final year medical students, we have to ensure that a degree a medical student got this year in 2020 is equal to the degree Dr. Beglaumi got in 1989, or even better. We cannot, remember quality from ICRA, it's right in our value. We cannot let the quality go down. And so unless we're sure that all of our students will have the right experience, enough experience, and will be great doctors, nurses, cardiologists, we have a whole postgraduate training program. Unless we can assure that, we will not graduate. That you can take from me as a guarantee. Now, to ensure this, it might be that they end up graduating a few months late. And if that happens, so be it. But we need to make sure that the quality of our graduates is always the best that you ever had. So when will we resume face-to-face? As soon as we are sure that we're ready to bring the students back with those 3 criteria, we'll get that. So with that, I'm going to stop, and I'm going to give the last question to President Rasul, if it's okay with you, Mr. President. And the question is very specific, and that is, it's about His Highness's choice to situate AKU in Pakistan. And if there was not AKU in Pakistan, do you think that the response to this pandemic would have been different in this country? So the biggest question to you, President Rasul.
Yes, it's a very, thank you, Adil. It's a very profound question. And I think it speaks to the vision of the founder, our founder and chancellor, His Highness the Aga Khan, who actually in the 1960s, which is now almost 60 years ago, envisioned a hospital, a university, a medical and a nursing school to create the capacity for the country to respond to these types of and other diseases. At the time, Pakistan continues to have a growing population and an ongoing need, a growing need for heavy medical facilities, professionals, technology, capabilities, capacity, both in the public and in the private sector. So it was the vision of His Highness to create that. And I think, Adil, you're right. Today, it is serving its purpose. It is actually playing the role that was envisioned for it. And I'm proud and pleased to say that the Chancellor is very happy to see the role that AKU is playing in the country. Not just caring for people and training people, but also helping the government, as you've given examples of how we are in partnership with them. So with that, I would like to thank all of you for joining us. First, all the participants, the supporters, the donors, for your remarkable contributions and your ongoing support. You give us the strength, you give us the confidence to continue to do what we should be doing. And your ongoing encouragement is very much appreciated. Of course, I want to thank the panelists. These are just but one group, and we have many people like the ones that you've just heard who are at AKU, and I'm very grateful to them, not only for today's participation and responding to the questions, but their ongoing commitment and contribution that they make to AKU in achieving its mission every day. And I also want to thank all the people at AKU who are both on the front line, dealing with patients, people who support them, security, food services, housekeeping, janitorial services, finance, other people, marketing, all of whom are involved in supporting the hospital in the way it goes. We have a slogan that we have adopted, which is stay strong and emerge stronger. And we believe we can do that with our supporters' ongoing encouragement and ongoing support to us, for which we are extremely grateful. So thank you very much to our team that organized this, and thank you for joining us. We hope you found this useful and informative, and we hope to see you soon at AKU hospitals, because as you've heard, we are here to care for you and we are safe, and we want to make sure that all of you receive the care that you need. So thank you very much, and assalamu alaikum. Khuda Hafiz.